Thank you everyone for joining us this evening for this important panel on current COVID-19 updates in our community. I want to thank the Oceanside Library Board of Directors, our Director Chris Mara, and our Assistant Director Tony Ivino for their continued support. Our library is proud to offer our community a diverse schedule of programs for all ages during this unique time. Please visit our website to see our program offerings. To moderate this panel tonight will be our Assistant Director Tony Ivino and myself, Ocaria Domingo, the Adult Program Coordinator. Our panel includes New York State Assemblywoman Melissa Miller, Nassau County District 4 Legislator Denise Ford, 4th District Council Member Anthony D'Esposito, Dr. Jacqueline Moline, Professor and Chair of Occupational Medicine, Epidemiology and Prevention at the Zucker School of Medicine at Hofstra University from Northwell Health, and last but not least, Kellyanne Brady, Clinic Director and Adjunct Professor at the Mental Health and Wellness Center at Molloy College. Thank you all for joining us today. Each panel member will update us on their department, and then we will open it up to questions from the community. Please write your questions in the chat, and we will get to them in a timely manner after all the panelists have spoken. So to begin, Assemblywoman Miller, we'll begin with you. If you'd like, you can share your screen.
Good evening, everybody. Thank you for joining and allowing me to come on. I'm going to do my best to share some of the information that I know everybody is craving so desperately. Needless to say, it's not been a very smooth process for vaccine distribution. So that's something that I can try and provide a little bit of information for. And if there are any questions, if I don't have the answer, I will do my best to find out and get back to everybody. So I will just jump in. I'll share some, let me pull it up. I can't seem to pull it off of my desktop, so maybe I can't. Okay, all right, forget that. I will.
Oh, there you go.
No, I don't. Oh, so I can get it off my desktop. Okay, there we go. Okay, can everybody see this?
Yes.
Yes.
Okay. So basically, one of the questions that I'm getting a lot about the vaccines are, how do I know if I'm eligible? There is a website through New York State that you can go to find out if you are eligible, and it'll take you through a list of questions. Right now, we are currently in what's known as phase 1B of the vaccination distribution schedule. And 1C is expected to begin between March and April, sometime around there. I'll go into a little bit about the 1A, 1B. 1A was set up to be the medical personnel, the frontline workers, doctors, nurses, the people in the hospitals. Then they kind of opened it up to staff in the hospitals. 1B is first responders, police, fire department, EMS, and it was originally supposed to be age, I believe, like 85 and up. Then they opened it up to 75 and up. And that more or less bottlenecked the entire system. The way the distribution system works from the federal government is every week an order is placed. Operation Warp Speed in the federal government, every week on Sunday, they do a survey of each state and the manufacturers. They check the production lines, they check the delivery schedules to make sure that the manufacturers are going to have enough product to deliver to the orders that are coming in from the states. The states are supposed to have their order in to the federal government by Thursday, and then they get distributed and delivered. There's an allocation to every state based on our population. New York's allocation number from the federal government is about 400,000 vaccine doses per week. The problem is that when the governor opened up 1B to 75 and up, that opened it up to about 7.5 million eligible people in New York State. 7.5 million people eligible and 400,000 vaccines coming in every week. And so here we have our bottleneck. And that I hear from a lot of people, a lot of frustration. The websites are crashing. They're using paper. They're literally using paper and trying to patch software systems overnight. Basically what the Congress, I just had a meeting with the congressman who basically said that New York's distribution system is antiquated. And so it's not set up to receive the amount of input that it's getting, the amount of requests. They did guarantee us that everyone who received a first dose has a second dose already. So when the first dose is received, they have already ordered and put aside the second doses, and they get shipped out from the federal government either 21 days after those first doses or 28 days, depending on the manufacturer. So that's one of the other questions that we'll get down to. I'll go down to that one. If you get if you have the first dose, you will get your second dose. If you're having trouble, wherever you received your vaccine, they are supposed to reach out to you to schedule your next appointment if you didn't make it that day that you got your first shot. And there is a reporting system. So it should be reported to if you have an adverse effect, if you can't get an appointment. All of this will be available. I can email it to anybody. Another question that I keep getting is, are people skipping the line? Do you have to show proper documentation? Everything has to be entered. So you're entering on good faith that you are eligible, but when you show up at a vaccine site, they will check for an ID or whatever documentation that you need. So be prepared. If you have an appointment, then you should be, asked to show that stuff. We've all heard about these fines, these consequences. They don't want the vaccine being wasted. There were, some occurrences of the vaccine being wasted, which is a terrible thing when there are so many people waiting. So we're not sure if those fines are actually going to be imposed, but it is an incentive to move the vaccines to somewhere else where they can use it. And so we'll see how that, to date, no charges have been, put on, but it's something that they're keeping an eye on. There should never, ever be a cost to get vaccinated. I've had numerous people call my office that they heard from this one, or they can go here to get a shot, but it would cost $75, or don't do it. If anybody tells you that they can get you a shot, but there's a cost, it's a scam, because there is no cost for getting a shot. And the last question, after you get the vaccine, they are still recommending that you wear a mask, that you social distance, that you practice the good hand hygiene, because not everybody's getting vaccinated. So we still need to try and, practice good hygiene. Like I said, all of my resources will be available. I can email them to the library, or if anybody wants to just reach out to my office, we can provide anything. And there was some talk on this phone call, on this Zoom meeting tonight with Congress about federalizing the vaccine distribution moving forward in New York State. They are going to try to work with the governor and see if he's willing to partner with the federal government on this. What that would do is it would bring FEMA into the picture, FEMA would come, set up their pop-up facilities. They would fully staff them. They would house the vaccine in the, the freezers that are one of the issues with storing the vaccine here. They would make sure everything was running smoothly, and they would go into the areas that are problem areas where our system right now currently can't get the vaccine distributed well. So this is something that's in the works, and hopefully if they do it, it has real potential to help. So that's something that's on the table. And that's that. Let me
Great. Thank you.
stop my share.
Thank you so much. And for everyone, Assemblywoman, you can email me that PowerPoint. We now have a new section on our website where we can share handouts and presentations from our programs.
Okay.
So we would love to share this PowerPoint. You got some great resources on there.
Yeah.
Thank you so much. And we see some questions in the chat. We'll get to them later. Thank you so much, everyone, for putting your questions in the chat. All right, next up, we have District 4 County Legislator Denise Ford.
Good evening. I apologize, I don't have a PowerPoint. My assistant ended up having to go for some emergency testing. So, but we will put something together and send it over to you, a carrier, so that you can put it up on your website. But I'm going to follow a lot with what our Assemblywoman Missy Miller had said, and some of the frustration we have in regard to people getting their vaccinations. For us, Dr. Eisenstein, who's our Commissioner of Health, has overseen all of our COVID response, in the beginning of, starting with testing, setting up protocols, and then also following up now with the vaccinating of our populations here in Nassau County. As you know, this is state controlled, so he has to follow whatever the governor in New York State then declares what needs to be done, who gets vaccinated. They are setting up, we have set up, pop-up events. We have pods at Yes We Can Center, I think it's in Bethpage, as well as over in NUMC and NCC. So we're looking to see if once more vaccines are available, to be able to expand the locations so that it makes it more convenient for many people that need to go get vaccinated, that we can. We had started, vaccinating a lot of the seniors. And at one point, I think before the governor expanded and controlled who was going to be vaccinated, 75% of the 4,600 vaccines, 75% of the 4,600 who received a vaccination about 3 weeks ago were seniors. And we, at that time, and I know that this is a concern for many, many people, trying to get our seniors vaccinated. And I know that those who are nursing homes and assisted living, CVS pharmacies had the ability to go in and start vaccinating those seniors. But then we also found that there were other facilities that fell out of that, and they weren't able to get any help from CVS. So we've been working with our New York State Department, with our Commission of Health through the New York State Department of Health, to try to get it so that seniors that are living in other facilities will be eligible and able to be vaccinated. Right now, though, one of the biggest challenges that we have is, for the seniors that are living at home. And our Office of Aging is working, setting up a telephone line that will be manned by people. It won't be a recording. So for the seniors that are having difficulty trying to register, to try to find locations for vaccinations, we're looking to be able to help them to be able to go through the process and get them appointments. And Dr. Eisenstein had said, of course, that wherever you went for your first dose, you have to go for your second dose. Our sites are vaccinating with the Moderna vaccine, even though we have the capability of storing and administering the Pfizer. He has opted to stay with the Moderna. He is also hoping that once the Johnson & Johnson vaccine is available, and we're hoping that it will be in March, and he feels confident. I don't want to jinx anything, but we're hoping that if this vaccine is available in March, there is an possibility that we can basically have a normal summer, whatever, if we could ever remember what a normal summer is like. So So we're keeping on top of this. We have weekly calls with our Commissioner of Health to make sure that we're staying on top of everything, to express a lot of the concerns that we hear from our constituents, and try to make this a little bit more fluid for everybody. And I think there is a lot of frustration, especially for our vulnerable seniors. I constantly am getting calls, about people whose parents are like 85, 95, they have underlying conditions, and they are not having the ability to be able to be vaccinated. And, I share the concern of our commissioner. I really think that they should have been one of the primary groups because a lot of them are stuck at home. They can't go out and they're afraid to go out without somehow or another being vaccinated. So we're going to keep on top of this. I keep in touch with Assemblywoman Miller, and then, also with our town Councilman Anthony D'Esposito, and I'm thrilled that Mount Sinai will be. I don't want to take it away from you, Anthony. I'll let you talk about it because it's actually a win for the town of Hempstead to do what they have. So, but I will send whatever information, and I'll enhance the information that I sort of rattled off right now, so that it will make it easier for people to understand what's really going on and how the county is dealing with this.
Great, thank you, Denise.
All right, thank you so much. And again, we'll accept that PowerPoint from you when it's ready, and we'll put it on our website so that everyone can have access to these great resources. All right, next up, we have 4th District Council Member Anthony D'Esposito.
Good evening, everyone, and Oceanside Library, thank you for having me. I've also received in my office many calls, many emails regarding vaccinations and if the town of Hempstead was offering vaccinations. So just to start, I just want to reiterate that unfortunately the town of Hempstead, we are not administering vaccines. We do not have a Department of Health. So right now we are trying to assist any constituents, any residents that we can with the state or county run distribution centers. But before I get into the vaccination and the plans that we have moving forward, I just want to touch on some of the efforts that the town of Hempstead has made, Supervisor Clavin and my colleagues on the board over the last 6 or 7 months. The town of Hempstead, is the largest town in America. We were the recipients of CARES funding, and we did utilize a lot of that funding to benefit communities in the town of Hempstead, and specifically the areas in and around Oceanside. Many Oceanside business owners, we spent about $3.5 million on PPE kits that were delivered to business owners and churches, libraries, and many other places. They were kits that were about $500 in value. They contain gloves, masks, thermometers, everything that's needed to keep your staff and keep customers safe. So those were distributed throughout the town of Hempstead. I know that there were dozens and dozens of Oceanside businesses that were recipients of those. We've also, in the last 7 months, we've allocated funding to food banks. And, it wasn't just our hard-hit areas that were utilizing these food banks. We really saw throughout the town, even in areas that would normally be considered middle to upper class, that in the midst of the pandemic, there were people that were really in need. So we were able, over the last 7 months, to feed over 1 million people, give and distribute over 1 million meals to town of Hempstead residents that were hungry. We've also helped our hospitals here in the town of Hempstead, providing them $4 million in grants. And one of the things that I think I'm most proud of, and I know that I receive texts and calls and emails each and every day, we set up testing sites both with Northwell and Mount Sinai South Nassau right in Oceanside. Mount Sinai South Nassau was a rapid testing site where you did have to call and make an appointment. And I know in the beginning, we did have some hurdles, and we seem to have cleared those. The administration and the staff at Mount Sinai have been great. And we also had testing, both mobile and stationary testing sites that we established with Northwell. And we've been able, over the last, since testing has began, we've tested over 15,000 town of Hempstead residents, first responders, frontline workers, senior citizens, those that were needed to be tested in order to enjoy the holidays. So 15,000 people is a lot of people to test. It's something that we're super proud of. We've also allocated funding for air filtration systems for seniors. If anybody that's on this Zoom has any interest and would like to contact my office, you could reach me at 516-812-3242 or by email adsposito@tohmail.org. And most recently, I'm sure some of you may have read about it or saw it on social media. Just the other day, Supervisor Clavin and the board, we have now entered into an agreement with Mount Sinai South Nassau right in Oceanside to purchase a mobile vehicle. It's a refrigerated large vehicle that is for now, or at least in the next 45 to 60 days when it gets on the road, we're going to begin to use it for testing. So we can dispatch it to the most hard hit areas, or we could have it at a stationary location, and we're going to be able to provide COVID testing. Once the vaccine becomes more readily available and South Nassau has the ability to start vaccinating outside of the 1A group, we are then going to transfer that vehicle to be used from a mobile testing site to a vaccination site. And I know there was some questions. The mobile unit is going to be ADA compliant and accessible for those who may be in a wheelchair. So that is a plus, and it's not going to be in service immediately. We're expecting it to be on the road within 45 days. So it's something to look forward to. If anybody here is part of an organization or has some ideas for us in the way that we can logistically utilize the mobile unit, please let me know. It's going to be completely run by Mount Sinai South Nassau. So it's not going to be something where once it does begin vaccinations, it's not going to be that you call the town of Hempstead and we arrange for you to be vaccinated. Everything is going to be handled through Mount Sinai South Nassau. So that's some of the things that we're focused on with regards to testing and vaccinations in the town. We've also worked, for those of you that are here that are business owners or just enjoy your local restaurants, we were one of the first to get behind and make as easy as possible the outdoor dining for local businesses. I know now it's getting much colder, but we have assisted with making sure that tents were able to be erected so that our local restaurants could still stay in business and continue to serve their loyal customers. And for you dog lovers out there, last week we opened up a new dog park at Oceanside Park. So if anyone wants to enjoy, although the next few days is going to be pretty cold, but if you're looking for a place to take your dog, we now have a new dog park at Baldwin Park, in Oceanside Park. There's one being built in Levittown, and there will one being built in Elmont. So I think that's all I got as an update for the town of Hempstead.
That's great. Thank you. Thank you.
Thank you so much. And that was great news to hear about Mount Sinai and South Nassau. Thank you for letting us know about that. All right. So next up, we're going to hear from a medical professional. We have Dr. Jacqueline Moline, Professor and Chair of Occupational Medicine, Epidemiology and Prevention at Zucker School of Medicine at Hofstra University, from Northwell Health.
Join the meeting.
Oh, thank you, doctor. That was perfect timing.
The voice from above comes. Good evening, everyone. It's really a thrill to be here. So I just, so my
Join the meeting.
occupational medicine, and we deal with exposures that may occur in the workplace, or actually it's occupational and environmental medicine. So exposures that may occur in the home. COVID, apart from those who work in healthcare or in an environment where they might be exposed, isn't what we would classically consider an occupational illness, but it still has become pervasive and has sort of taken over everything. One thing I do want to make people aware of, and when I finish speaking, I'll put the name of our clinical center in the chat box. We do have two New York State funded occupational health clinical centers on Long Island. New York State has a clinic network system. And we have a clinic location in Islandia and one in Great Neck. And we're happy to see anyone who may have an exposure in their home or in their workplace. that needs care. Now, what I thought I'd talk about, and I don't have any slides. I was going to make slides, but being a professor who gives talks all the time, I think on Zoom slides can be a little challenging, especially at 7:31 at night. So I think that what I'd like to do is just go through a little bit of what the various vaccines are. Luckily, I don't have to talk about vaccine availability because that's been ably covered by our legislators. And I wish it were more available because I really do hope that everyone can get vaccinated as soon as possible. And just so everyone knows, I've been vaccinated. I had 2 vaccines and want to let people know that the side effects that I had and among everyone that I've asked have been very minor. They've just been sore arms. So hopefully that won't dissuade anyone. But let's just go through some of the vaccines that are currently available and those that are coming down the pike so people are aware. The Moderna and the Pfizer vaccines are very similar. They're based on mRNA, which stands for messenger RNA, which is basically proteins that tell the cells what to do. So the way these vaccines work is they code for the spike protein, which is how the vaccine attaches to the cell, to the normal cell, and it prevents it from entering the cell. The body has an immune reaction saying, hey, I don't like this spike protein. This is something I've seen before, and then develops an immune reaction to fight the virus. Operation Warp Speed started in 2020. So why should we trust a vaccine that's just been around for a year? And it seems like it's awfully fast that it was developed this quickly. And I know that's a concern that many people have. The reality is the technology for mRNA, messenger RNA vaccines, has been around for decades. And it actually was used in the first SARS. They were beginning to develop a vaccine for the first SARS using this technology. But when they realized that pandemic, or that never really became a pandemic, or that epidemic sort of died out on its own, they didn't have the need for a dedicated vaccine for it, but they had the technology which allowed them to move so quickly to develop this vaccine. The difference between the Pfizer and the Moderna is in how the messenger RNA is packaged. One has more of a lipid or a fat surrounding it, which is the Moderna, which allows it to not require the very low freezer temperatures, which is one of the challenges with widespread Pfizer vaccination. Pfizer is every 21 days. Moderna is every 28 days. And just so people know, you should be given now a second, if you're finally are able to schedule that vaccine, you're supposed to be given a second date. So the return date. Now, what happens if something happens and you can't make it to that appointment? Are you still going to be okay? As long you can just get the second vaccine as soon as you can get it. So don't worry if it isn't the exact 21 days or the exact 28 days. So those are the 2 that are currently available. I think that Mr. Esposito mentioned the J&J vaccine that's coming down the pike. If there should be news on that next week. The Johnson & Johnson vaccine, I think, is going to be a game changer for us in terms of vaccine delivery, in that it is a different type of virus. It's based on a standard vaccine platform, similar to how flu vaccine is made. It doesn't require the same level of freezer. It's a one shot, and it can be rapidly produced. So it's, if the results from the clinical trial, which the word is that it's supposed to come out at the end of next week or shortly thereafter, and then hopefully they'll get the emergency use authorization. If it works well, then there will be a lot more vaccine, and hopefully everyone who needs the vaccine can get vaccinated. There are others people may have heard about, including the AstraZeneca, which appears to be about 70% effective. There were some challenges with that clinical trial, but it is being used in England right now. I think they're vaccinating their entire population as quickly as they can because they have some of the variants that tend to be more contagious. And then there's also another vaccine that's coming out, which is the Noravax vaccine, which is another 2-shot deal. And that's on another platform. So there are a number in development. So when we have all these choices, I think you'll be able to talk to your doctor and find out which is the best choice for you. The reality is, if you can get vaccinated, in my opinion, because these have been shown in now, I think it's about 25 million people have been vaccinated in the United States. And there have been, while there have been scattered reports of people having allergic reactions, there have been very few reports of serious consequences. People tend to have a little more symptoms after they get the Moderna vaccine than particularly after the second shot than they do after the Pfizer vaccine, but that's not a reason to choose one over the other. The Moderna is actually a little easier to give in a community-based setting. There are some questions about whether it's safe to give in pregnancy. The American College of Obstetrics and Gynecology at this point has advocated for getting vaccinated while pregnant. And there is no point in getting a blood test to see if you're immune once you're vaccinated. So that is not in any of the guidance. One thing I do want to make people aware of is the CDC website. Looks like it's undergone a bit of a change. I don't know if it's with the change of administration or I haven't looked at it for a couple weeks, but I was looking at it and they have some really nice one-pagers, some FAQs, for example, and I can put the URL is just cdc.gov, and if the first thing you see will be COVID. This talks about the mRNA vaccine. So this gives you some questions about the currently available vaccines. Question that people have is it going to be effective against the variants? And there are 2 variants that people are concerned about. One is the British and one is the South African. And the concern is that that's going to lead to some major problems in the next 6 to 14 weeks because they are more contagious. The variants are more easily spread than the current virus that is circulating in the United States. It appears that the vaccines are effective against these variants. It may be that there needs to be a modification and people need to get a booster in years going forward, like everyone has to get an annual flu shot, you would also get an annual COVID shot. One thing, if anyone has any fears about the vaccine, which is totally understandable, the clinical trials for both Moderna and Pfizer, the ones that we have all the data for, show something that is just so important, which is that there was no deaths from COVID in people who received the vaccine when you compared it to the placebo. In one of the trials, and another one, the numbers were like 4 compared to, I don't know, a much higher rate. What it does is it prevents people from having severe disease that would require hospitalization, intubation, or severe disease. So while we're not sure, because none of the clinical studies were designed to see if it prevented people from spreading COVID to each other, which is our ultimate hope, what we do know is that you won't have severe COVID-related illness once you get vaccinated in well over 95% of the population, which is more effective than almost any vaccine that we're aware of. So it works against the variants. It's the faster we can get these vaccines up and into the population, the less chance that the variants can take hold in our population, and we'll get everyone protected. One thing I do have to stress is that because we're not sure if you can spread the COVID after you've been vaccinated and you're exposed, this is not a time to let down our guard. While I feel a sense of relief that has washed over me because I've had my 2 vaccines and I know I'm not going to have severe COVID, I still wear my mask, wash my hands, practice social distancing, and those things are so critical. We know that can help us get our kids back in school. And there's a study that just came out and made all the headlines that saying kids should be back in school if they have the proper mitigation in the communities. So it wasn't just let's send the kids back to school. It was make sure we send the kids back to school with masks, social distancing, adequate cleaning, having a good testing program. And that's something that we need to make sure going forward. The other thing is, until we have this really under control, it's really important to limit those home gatherings, because when you're at home, you let your guard down, you're not wearing a mask, people can be asymptomatic and spread it. And there have been so many cases post holidays of where one person came and then 11 people 4 days later had COVID symptoms. And that person may not have had symptoms when they showed up at the gathering. And testing before you go to a gathering gives a false sense of security, because if you're tested in the window before you have enough virus to show, then you may still be infected and are capable of spreading it going forward. So for a few more months, we have to be just really cautious, and hopefully we can beat this and get back to having summers at the beach. So with that, I'm gonna take your questions at the end, and I'm gonna turn it back to you.
Great, thank you very much.
Thank you so much, Dr. Moline. You had some really, really good information there, and some great questions came up. So we really appreciate your knowledge on the vaccine. All right. So last we have Kellyanne Brady. She's the clinical director and adjunct professor at the Mental Health and Wellness Center at Molloy College. And mental health is so important during this difficult time. So could you please let us know what important services Molloy Counseling Center is offering to the community, and why it's important for us to stay in touch with our mental health?
Absolutely. Thank you so much to Oceanside Library for having me here to talk a little bit about this also very important issue. The pandemic continues to really cause a lot of difficulties with individuals being able to maintain and manage their mental health. And during this time, we've seen so many people struggle with various issues. And one of the challenges is that as we go back into the winter time and the darkness and it's cold and we can't get outside and we can't maybe do some of the activities that we had been doing, we're finding that depression's increasing, anxiety's increasing, the feelings of frustration and isolation are coming back. And one of the other challenges that goes along with this is that people are starting to feel, as we've all probably heard, zoomed out. They're struggling with engaging with online programming. They're more reluctant to engage with, supportive programming that would help promote connection within the community. So it is really important during this time to kind of keep an eye on your mental health, to notice any sensations of feeling more sad, feeling less willing to maybe want to get out of bed, or, if you find yourself losing interest in things that you've normally enjoyed doing, kind of take an inventory of that and say, do I need to connect with some mental health services to just kind of help support me through this time? We've talked a lot about hopeful information today with vaccines, and we're looking forward to hopefully getting back to more normalcy in the summer months, and that would be great. So we have to focus on what is our future, what is going to be coming in a few months, and that would be really hope, provide us with that sense of hope that we need to get through this difficult time. So I'm here to kind of talk a little bit about what we have been offering the community and what we continue to offer the community. Back in March, we started our first virtual program with Oceanside Library and talking about coping in times of crisis. And we've continued to offer programs through Oceanside Library and also other libraries across the county. And we've even expanded into Suffolk County. So we continue to offer these community programs pretty regularly, and they're open to anybody in the community. We also offer free workshops through our center that are all virtual. Our center also continues to offer fully virtual programming and mental health services at this time. So we are offering individual, group, family, and couples counseling for individuals of all ages. We have, because we have partnered with Malloy, the Mental Health and Wellness Center is able to offer very affordable and accessible mental health services. We have a flat fee for our services, and we can get people in for appointments within 1 week, which is really huge. We've recently expanded our clinician base so that we can really be able to serve the surrounding communities. We're located in Rockville Center, right off of North Village Avenue.
That's, excuse me, we call that North Oceanside.
Okay. So, we'd absolutely be, we're very accessible even when we do return in person. So I want to let everyone know that if you or anyone you know is struggling, we're here for the community. And if you would like to follow us on social media or any other, any of the social media platforms, or if you would like to be added to our mailing list, I'll enter our email address and our website into the chat after I'm done here. And we'd be happy to get you connected to our services and any support that you or your loved ones may need. Thank you so much.
All right, thank you very much. All right, we're going to start going through some of the questions. I will throw out my one little comment, and that is, I know that, and you can see it in some of the questions in the chat, there's a frustration level, and not necessarily, actually, the more local we get, the less frustration we have with the government officials. But I think a lot of us were very surprised that the distribution of the vaccine and even the testing seemed to take everybody by surprise. That the mass vaccination centers weren't set up 7 weeks ago, 8 weeks ago, that we're not all on a list somewhere, okay? We should all, in my opinion, we should all be on a list. Missy, you want to?
I'm not surprised. I don't know why you're surprised, but I honestly, this, and I'm not trying to be critical, I'm just being realistic. When you have an allocation, a set amount that is being told, it's a formula, it's based on population. So this is what, according to 85 and up, seniors, right, and medical staff or whatever it is, this is the formula, this is your allocation. The state has an obligation to keep that in the forefront of their minds when setting phases and saying, okay, phase 1A is this amount. If we know we have 1 million people in this phase, we can't open up phase 1B yet. That's irresponsible. And so it just created,
Yeah. And again, I'm not even talking about on a state level. I'm talking, and again, I don't want to get into too much, but the problem is, we know that there's going to be 20 million New Yorkers that are going to want to be vaccinated. We should all be on a list now, and they should just pull. They get 10,000 doses, pull the next 10,000 that are in. I can't believe that Google wasn't asked to set up a website for the nation back in March or April. We knew this was coming, but I'm not going to get on my soapbox. I'm going to go through some of the questions that we have here.
Definitely a learning curve for everybody.
Yeah, one of the questions that we have a few of them, and I don't know who wants to take this, but one of the frustrations we have at the library is because typically we would be a portal for people who aren't technologically capable of, let's say, getting on a website. We're the ones who would usually do it, and we're locked out. There's no way we can do what we would normally do. So how are we getting the vaccines to handicapped adults? How are we handling our special?
I'll take that. So firstly, from the moment that vaccine distribution lists were released, I, more than anybody who lives this, was like, where's the handicapped people portion? What are people with underlying conditions doing? So I have been, since day one, questioning, writing letters, emailing, calling everybody, the commissioner, Dr. Zucker, the governor, the commissioner's staff, the governor's staff. I mean, I've had multiple conversations with the Nassau County Health Commissioner, trying to find where this population fits in, because they don't seem to have been really included. They did finally, they put into a phase the individuals with disabilities or medically frail individuals who live in congregate settings, based on their data that congregate settings, foster more of these, you're more likely to get the infection. So I understand the philosophy on that thinking, but then they went and opened it up to home care workers, home care health workers, which is very smart. Home care health workers who are coming into the homes of all the hundreds of thousands of individuals around our state, senior citizens, as well as disabled people who are living at home and need care in their home. Their paid caregivers are eligible. However, their family caregivers are not. And many of those family caregivers for elderly people especially are elderly themselves. They're not eligible yet, unless they're over 75, but also the individuals themselves aren't eligible, the disabled people and the medically frail people. So it is a gap. It's something that I've been very, very vocal about since day one. And it's something that I will continue to press them on until they are put into a phase. The problem with the phases is that, I see the questions coming in. Why aren't the endocrinologists giving it? Why aren't the doctors giving it? They can't possibly open up more of a phase when they can't meet the demand of the phase that we're currently in.
Got it. There is one of the questions, which is a good one. I think, Denise, I think you touched on it, is how are we getting vaccines to people with no internet access for making appointments? That's a big problem we have with the library, is getting out information to our patrons who aren't online.
And that has been a challenge, and it has been very frustrating, for all of us. And to be quite honest with you, a couple of weeks ago, we were working with Dr. Eisenstein to address that for our homebound seniors, those that do not have an internet, they don't know how to. And I'll tell you, even trying to make an appointment when Jones Beach opened up, or Aqueduct, it seems that some of us older people, I tried trying to make an appointment. I got lost in the system. But when you look at some of the younger people, they just seem to know how to be able to click on something and make appointments to get the vaccine. So for me, it's a challenge. I can only imagine some of our seniors who don't have the ability, or who don't have laptops. So
we set up it through the state, because there were so many people calling and saying they don't have internet, they don't know how to use the computer, the seniors. So they did set up a phone hotline, but that is, you get busy, or nobody answers. It's a problem statewide.
And then what we're trying to do is, right now, because of the scarcity, basically, of the vaccine, as I said, that we had started, Dr. Eisenstein's focus had been to try to vaccinate as many seniors as possible, because they were the most vulnerable of our population. When all of a sudden New York State opened up those who were eligible, it then added thousands of more people into a pool. So as a result of that, it's hard. So we're trying to set up something with our Office of Aging so that the people will call in, okay? They will have somebody work with them, all right? And then we would be able to make an appointment. And I think that even his desire is at some point to be able to hold back some of the vaccines just for seniors, rather than always keeping them allocated for everyone else. But we're under state constraints right now, which is just very, very frustrating, to be quite honest.
Listen, I just have to tell you, from somebody that works with the stuff that we do at the library, and I don't understand, why aren't we taking a list of the people that eventually want the vaccine, and then we contact them for appointments, rather than making these poor people sit for 3 or 4 hours? We know, listen, I'm going to take the vaccine whenever I can get it. Okay, I'm not in 1B, but I'm going to get it. So why not take my name and number, and when the state gets down to whatever the level is, then contact us? I don't understand
all right. I apologize.
Billions of dollars that are being spent, why this isn't being done in a logical sense, rather than this helter-skelter kind of
I understand what you're saying now. I think I missed in the beginning how you were approaching it, but now, and I think it actually is a good suggestion. And I am going to reach out to Dr. Eisenstein tomorrow in our Office of the Aging. And I think that that's something what we need to do. So you're saying, rather than waiting for the vaccine to be available and people go online and try to make an appointment to get a vaccine, you're saying that for those that are vulnerable, those that are at home, whether or not they have underlying conditions or they don't have,
No,
they reach out to us. We have a list of everybody, whether or not, like I have somebody who's 94 years old.
Right.
She needs to get the vaccine. So what I would do is I would take her name, number, her information, and then we would reach out so that we could sort of set aside time for her to make sure that she then get the vaccine.
right. Well, actually, Denise, I'm even saying even more. I don't understand why we didn't have a Google sheet with your name, your age, your if you have a special condition, whatever the situation is, and then just the computer do it. And you're getting 10,000 vaccines next month or next week.
Yeah.
Call those next 10,000 people. You send them emails, or if they don't have the email, you call them and set up the schedule. I don't understand why we're doing this to make it even more frustrating for people that are scared and are frustrated. Let's see. Somebody says, I have here, people with disabilities are not yet considered 18 in New York. I've been following. I guess we were talking about the special needs population. Let's see.
If I can just talk about the age, there are a number of questions about pediatrics.
Sure, if you could. Thank you, Doc.
So the Pfizer vaccine, the trials included individuals 16 and up. So Pfizer is available under the authorization for age 16 and up. Moderna is 18 and up. J&J is currently only 18. When it becomes available, will only be 18 and up. Typically in clinical trials for new vaccines, they do it in adults first, amass enough of a safety profile before they'll allow it to be administered to younger children. All of these vaccines currently have clinical trials going for 12 to 15 in the Pfizer, and that actually they have completed enrollment. So they expect to have the results of that fairly soon to ensure the safety profile and all along those lines. Similarly, Moderna is actively recruiting, and there are a number of sites that are recruiting for vaccine from age 12 and up. It doesn't look like, and that's what's going to be available this year. I think it's not going to be until next year where under 12 will be authorized or allowed in younger, because it's also weight dependent, dose dependent. So it's a challenge because the younger kids are not getting it. And I know there's concerns about the MICS and the multi-system inflammatory condition. And it's unclear. It's related to COVID infection. So if once the vaccine becomes available, then theoretically that should diminish that. Once someone has the COVID infection, they should develop antibodies, so they should be protected for several months. Initially, the guidance was if you had COVID, you could wait 90 days before you got the vaccine. A lot of that is vaccine availability. Now it's really, if you can get the vaccine, there's no biological reason not to get the vaccine, even if you did have COVID. So unfortunately, if you have, my kids turn 16 next month. So when their group 3 or 4, whatever young healthy kids are going to get, they'll get the Pfizer because that's authorized. But otherwise it's going to be 18 and above.
Okay, thank you. There's a question about whether we could have, however it gets funded, have people at the library help make people appointments. The problem is we can't do it. We don't have a safe way of doing that on such a direct method.
And Tony, if I may, just because the town of Hempstead is mentioned with CARES money, it's not the issue of providing people to make the appointments, but there's no appointments to make. It's like taking reservations for a restaurant that has no seating left. So,
right.
It's very difficult. I mean, it's not about the funding, and it's not about getting people to make the appointments. It's that there are just no appointments available.
Yeah, I think that's the point. I think if there was this, like, again, and I don't want to harp on it because I came up, if there was a database that was taking the information so that you would pull from there to make the appointments, then yeah, then we could set up either teen volunteers or staff volunteers. We would be able to coordinate that to help people get on that list. But when you're just talking about those slots, like you're trying to get tickets to Billy Joel, it's very challenging. Doc, there's another question here. Are there any long-term side effects to either vaccine that we know of at this point?
Hasn't been around long enough for us to know. And our hope is no, but that's something that we'll only know with time. The vaccine trials started in the spring, so we only have about 7 months of data on people who've actually had the vaccines. So we don't have any long-term data. We have months of data, but we don't have years of data, with the expectation that usually you see these things manifest. And 25 million in the US and many more worldwide have gotten the vaccine, and some started a little before us. So we would expect that we would have heard about severe complications if there was anything that, like with the swine flu vaccine in the, was it the 70s or 80s, where there was the Guillain-Barré syndrome. There hasn't been any of that reported thus far. And they're different platforms. There's no risk of that from these vaccines.
Okay, and another question. Some people are sending it to me in direct messages, so that's why I might have seen it in the chat. What we seem to be hearing some guidance is about double masking. Is that?
Oh, great point. You know what? Two's better than one. And I think depending on where you're going and what your health status might be, there seems to be some information coming out that 2 masks are definitely safer. It's a double barrier. It will reduce transmission and reduce your ability to both spread, but more importantly, for you to catch COVID from others. So if you can find 2 masks that are comfortable and find that you can wear them, go for it.
Okay, thank you. There's a comment from Elizabeth. Thank you. Very informative. We're getting a lot of that, by the way, for all of you. Friends in other states call to register, then they're notified when it's their turn. Will New York consider this with FEMA support? And so we've kind of touched that. Somebody asked, is it safe to nurse after receiving the vaccine?
There has, as far as we know, it's safe to nurse, and that's a risk benefit. You should always talk to your doctor, but there has been, it is felt that it is safe to nurse. Again, I would have a conversation with your pediatrician, but it's felt that it is safe to nurse after getting the vaccine. It's a great question.
Okay. For our county and town, it seems to me that it's going to be a long time before we have everybody vaccinated. And it also has seemed to me, and I apologize to a carrier who's been hearing me rant about this since February, that the key to this whole thing was and still is testing and pulling people that are asymptomatic out of the population as much as we can. Are there any, because I know you guys aren't necessarily involved with the vaccine, are there more plans on increasing the testing and the availability of mass testing and not just testing somebody's feeling badly?
I'll start. Obviously we still have the testing site that's operating at Mount Sinai, South Nassau. And that is in place to test those who, have symptoms, who are concerned. And that's what that is there for. And obviously that's the reason why we entered into this agreement with Mount Sinai, South Nassau for this mobile unit, is to continue exactly that and continue that mass testing to make sure that we're not spreading coronavirus. So once we get this mobile unit on the street, that is its sole purpose, is to travel, our 1,200 miles of roadway in the town of Hempstead and test people. And that's really the focus. Until we have the ability, or South Nassau has the ability to vaccinate people from this mobile unit for the foreseeable future, it is going to be for the sole purpose of testing.
Okay, thank you. Let's see, we have a lot of them were kind of duplicative, and you guys have already covered, and we appreciate so much the time. We have somebody, what if your antibodies have increased in the past 6 months? I don't know what that impact is.
I think that good for you. You've got a good immune system.
Okay.
Doesn't mean you shouldn't get the vaccine. And if there's a slight chance that you might have more side effects from the vaccine, but it seems that people who've had COVID seem to have a little bit more of a feeling feverish for about 24 hours. The antibodies, some people it goes down, some people it goes up. I'm happy you have the antibodies because it means you're protected for now. So, but it doesn't mean you shouldn't get the vaccine if you can.
Okay. One of our people is
Tony, can I just jump in for?
Yeah, please.
I know that there's two questions. Trying to rewind back here. I think one was, can South Nassau set up appointments for seniors without access? And then another question was, I guess, why has Nassau not set up pop-up vaccination sites? I don't want to answer for Denise, but with regards to the South Nassau issue, is that the South Nassau, unless it's changed in the last 24 hours, South Nassau only right now has the ability to test in 1A and first responders. They are testing only firefighters, EMTs, nurses, doctors, cops. That is it. Actually, cops might not even be on the list. I think it's EMS, fire department, nurses, doctors. They are not authorized yet by the other levels. So to make an appointment, unless anyone on here is an EMT or firefighter, you guys should be getting your vaccination direction from your fire department, your EMS provider. And then the other question was, why has Nassau not set up pop-up vaccination sites closer to Oceanside? I don't want to answer for Denise, but I think that the answer is the same as it's been throughout the last hour, and that's just the access to the vaccine. I don't want to speak for her, but I know that if there was the opportunity to have more vaccinations and the ability to vaccinate more people, whether it was NUMC, whether it was Mount Sinai, South Nassau, whether it was the Catholic Health Services, Mercy, we would make it closer. We just don't have the ability to provide the vaccine right now.
Right. I think
Exactly.
Yeah.
I'm sorry. Oh, I didn't mean to always talk you, Tony, but Anthony is right. We are constrained by the number of vaccines that are available. We are looking that once the vaccines become more available, we have more vaccines, we are going to expand our sites. And I think that one of the things we have to follow, Dr. Eisenstein was telling us that wherever we already had, I guess in the years past, we had set up remote sites to vaccinate people with the H1N1 flu vaccine. And so those sites that were already used then will be the sites that they'll probably set up to do the coronavirus vaccination as well. But we are looking to see so that we can expand it so that more and more people will be able to find it easier to get vaccinated.
Okay, but just so I have a couple of private messages here, just so that we're clear, it's either going on the website and finding a vacancy or calling the state number. Is that correct?
Correct. Right at this time, yes.
Okay, so I hope that answers.
Tony, are there any more pressing questions? Because I'm going to have to.
Nope. I'm going to let everybody go here now. I do really want to thank our panel. Ocaria, thank you for putting all of this together. We appreciate it. On behalf of the Oceanside Library, our board, the Oceanside community, we want to thank you all. Kellyanne and Dr. Moline, thank you so much. And of course, and I say this all the time, we are blessed with wonderful government officials up and down, okay, who are always responsive to us and are always here for us. And so I specifically want to thank Missy and Denise and Anthony for coming out here tonight. Thank you all very, very much. If anybody has any additional questions, you can always reach out to the library. We will be happy to give you, that's what we do. We'll give you as much information as we can and put you in touch with everybody. So thank you all very, very much. Have a wonderful evening. Thank you.
Thank you. Thanks.
Take care, guys. Thank you.
Good night, everyone.
Good night.
Bye-bye.